So this is how basically our heart looks like. It's a four-chambered organ, right? Whatever we talk about, um, the important thing is the left ventricle, because the left ventricle is the major muscle mass of the heart. This is the one, the next slide please, which is supplied by three major coronary arteries. The one on the left, that is the left coronary artery, dividing into two branches. The front one being called as the left anterior descending, the central is the circumflex, and we obviously have the one going on the right, that is the right coronary artery. Now, what exactly happens next, please? Heart diseases can be divided into various categories. The congenital heart disease, that means the heart problems associated with cardiac problems of the newborn. Valvular heart disease means there are valves in the heart, and these valves are the ones which allow unidirectional flow of blood in the heart. So if the valve becomes narrow, we call it as stenosis, or it starts leaking, we call it as regurgitation. Then we have various problems. We'll be dealing about them a little later. In short though, cardiomyopathy means disease of the heart muscle per se. As better and newer treatment modalities are available for treatment of valvular and coronary heart disease, right? The longevity of patients with heart problems has increased. So heart as a pump or a muscle, the failure of heart muscle is known as cardiomyopathy. So large number of patients with specially and specifically diabetes increasing, increase in diabetic population amongst us due to a rising trend in diabetes, we see more and more number of cases with cardiomyopathy. Cardiomyopathy means the heart muscle weakens even though the coronaries may be normal. I'll be talking mainly today on coronary artery or coronary heart or ischemic heart disease. All are synonyms used very easily interchangingly, though the meaning remains same. Death rates, yes, these were the projected rates, and we've already crossed the 33.5 million mark in 2015. It's almost on an average around 50 million as we speak today. Almost you can say 25 to 30%, right, of morbidity and mortality related to coronary heart disease is happening in India as we speak. So we are number one as far as heart problems are concerned, a number one, not to be proud of though. So what can we do as primary doctors to educate our population? What can you do, right, in order to ensure that this rising trend breaks off and we do not fall into the trap of coronary artery disease, right? So if I talk about a patient of heart problem, we can divide him basically into three major categories. One is stable angina. The patient will say, well, I do get chest pain when I walk. Means the demand, when the demand is more, the heart needs more oxygen supply. The more oxygen for itself, the supply is inadequate. So there is a mismatch between the demand and supply, but it is stable. He'll walk for 1 kilometer, he'll get pain, he'll have to say stop for about 2 to 3 minutes. Demand goes down, he's again able to walk till a critical point when again there is a demand supply mismatch and chest pain comes up. So he tells you that I'm walking 1 kilometer, I get pain, I stop, fine, again I walk, again I get pain. Unstable angina. Now this patient of a stable angina starts complaining that now my distance has reduced, so only after 500 meters maybe I start getting chest pain. Or first episode he's come to you today and suddenly he says, no, after meals or even resting, my chest is hurting or throbbing. And of course we have the classical acute myocardial infarction. We are all very well aware of that. It's a major attack, right? Heart attack is acute myocardial infarction. All hell has broken loose. The artery has shut down. patient is in severe pain. The next slide, please. So angina means lack of blood supply, right, to the heart muscle. It's also known as angina pectoris. That means chest pain originating from the heart disease. What happens is the fresh blood, that is oxygen, the supply to the heart muscle is reduced. The heart cries out in pain, resulting in chest pain or angina. It is similar to the cramps which you get in your calf muscle after excessive work. The most common cause of angina is narrowing of one or more of the three arteries which we did speak about, which supply blood and oxygen to the heart muscle. The next slide, please. Right, so this is a classical picture from our old 150-year-old textbooks. Means a patient complaining of, you can see, you keep your right hand, the fist you close, keep it on your left chest below your breast tissue or around your nipple, and that is where your heart is. Now if there is a severe constricting pain, कपड़ा निचोड़ रहा हूं वैसा पेन हो रहा है, पेन radiating to the left side of the lower arm, such a kind of pain which I have never ever experienced before. If the patient or if you experience such a kind of pain, do not ignore, rush to the nearby hospital and let the medical people evaluate you. You may be having a heart attack or an unstable angina, and you need immediate attention. The next slide, please. Right. So what are the basic causes? The coronary arteries, they narrow up. Plaques means the blockages, they gradually build up. The next slide. And this is what is seen classically. So first what happens is endothelium, vessel wall, andar ki diwal, as we call it, it becomes unhealthy. So it starts attracting the fatty tissue, which fats, unsaturated fats, which are moving around, dissolved in the blood, and starts attracting them like a magnet. So fatty streak 1 goes into form what we call it as atheroma. Atheroma means, yes, they are not only streaks, but they have started depositing over there and start forming blockages. Now, this is a simple atheroma, means it's like butter or cheese. Over this thick leathery tissue, when it develops, it's known as a fibrous plaque. Now, what happens is, as long as you have a fibrous plaque, thick, rubbery inner coating, you're sort of safe. You may be in a stage of blockages being asymptomatic, that as we call it as asymptomatic CV disease, cardiovascular disease, or chronic stable angina. However, if this thick fibrous cap or covering, kapda, उसने जो पहन रखा है वो फट जाता है, it tears off, right? And what you see here is a blood clot forming. Then the artery gets totally occluded. 100% blockage is formed over there. No blood flows beyond the beyond the blockade site, and what the patient experiences is total blockage of blood supply and severe heart attack situation. So in this, suddenly your exertion, excitement, or argument with somebody, and the artery cracks from inside, blood clot sits, severe pain starts, the patient is having a heart attack. What are the risk factors which we talk about? Right? Age, if age with a strong family history, as I would like to call it, before the age of 55, if the male or father or elder brother has had a problem of a heart, or before the age of 65, if the female or first degree relative, the mother or the sister, has had a heart problem, then you are at a high risk for having a heart problem because you have a strong family history. The next slide, please. Right? Cigarette smoking. See, for that matter, cigarette smoking or consumption of tobacco in any form is very, very harmful. Right? If we talk about the risk of heart failure, today you give up tobacco in any form, the risk of heart problems will come down to that of a normal population. The next slide, within 6 to 12 months. But the risk of malignancy, right, will come down to the normal population after you quit use of tobacco. The duration is a massive 20 years, that is 2 decades. Smoking increases the probability of not only heart attack, brain attack, kidney attack, legs of the vessels getting chewed up. The next slide, please, by 2 to 4 times over as compared to a non-smoker. The next slide, please. Right? Blood pressure, again, a major killer. We say the systolic, that is the upper, and the diastolic, that is the lower. So if systolic blood pressure is more than 140 and diastolic more than 90 on 3 various occasions, or 3 different readings taken 2 minutes apart, so your average reading is high, you are a hypertensive, you are at a high risk of coronary artery problems in future, and should consult your doctor immediately, start lifestyle modification and treatment. The next slide, please. Right, so the normotensive, this is a classification which we all should remember. Right, we have Google in all our smartphones to download and keep it and save it as a screenshot. We have watches today in which the blood pressure, the heart rate are recorded. So we all should keep a track of what is happening to us. The normal blood pressure being less than 120 by 80, 120 to 139 upper, and 80 to 89 lower, that the systolic and diastolic are the upper limit or the range of normal. If your blood pressure is between 140 and 159, the systolic, and 90 and 99 diastolic, your stage 1 hypertensive. If you are more than 160 by 100, your stage 2 hypertensive. The next slide, please. Right. So what is cholesterol? Everybody needs cholesterol. Each and every cell of our body, the wall is composed of cholesterol. It's an important component of the nerve tissue, brain and spinal cord, as well as a major component of a plaque that clogs your arteries. This is an important slide. The next slide, please. From my perspective, because a large number of patients post an angioplasty procedure when done by me, or a bypass surgery done at our Hinduja hospital, come and say, I have totally stopped fat in any form. No oil, no butter, no cheese, no ghee. That is wrong. The body does need 2 to 3 teaspoons of oil, butter, or ghee a day. Anyone, right? Because a large number of our hormones, you can say the lubricant oils between our joints, are all made up of fat. So consumption of fat along with carbs and proteins is required, which leads to the formation of a balanced diet. We are all into the habit of more and more going into health checkups, and a large number of patients again come up with reports. So we have, according to the famous Hollywood movie, The Good, Bad and Ugly, right? So we come from bottom, that is HDL, that is the good cholesterol, should always be more than 40. More than 60, usually 50 to 60 in premenopausal women. After menopause, again, for more than 40 is what is recommended, right? LDL is ugly. So let's go on to the bad. Triglycerides 150, and ugly is the LDL should always be less than 100. Now we follow the West, right? West says you go and reduce the LDL and you'll be fine. We say the good doctors, the bad doctors, the worst doctors. Good doctors are the family doctors. They catch you, you go to them. They treat you for cough, fever, cold, lifestyle changes, everything. Bad doctors are the MD doctors, MD physicians. So they're treating you for blood pressure, diabetes, cholesterol, and the worst, right? That is the super specialist. That is my category. Now you've landed up with problem with blockage. So you've come. There are specific indications to remove blockages. Angioplasty, catheter based. We put a tube in your heart, put a stent and come out. If you have 1 or 2 blockages, yes, it can be done. If there are multiple blockages, no, bypass surgery is what is recommended. So each one has its own place. A lot of patients come up and say, I have 1 blockage, can a bypass be done? Or I have multiple blockages, can an angioplasty done? Is angioplasty better than a bypass, or is bypass better than an angioplasty? Both are separate, both have their specific indications. And if an angioplasty is indicated, there are certain rules set down by the American College of Cardiology. So if there are certain set of rules to be followed, angioplasty is indicated, bypass should not be done, and vice versa. Next slide, please. So what exactly we do in an angioplasty? We put a wire across the block. We open up with the balloon. The next slide, please. So, and this is how we put the wire. We open up with the balloon. We remove the air from the balloon. It goes out. And now everything is done from the wrist, the radial artery. The next slide, please. So this is what a stent or a metal spring or a mesh or a jali, whatever you want to call it, looks like. The next slide, please. So here you see there is a block. We open up with the balloon, wire, everything comes out. The last figure shows the metal mesh or the spring stent stays inside. The artery is open, the blood flow is restored, the pain goes away. Beyond the stent, the entire artery starts receiving proper blood supply. The next slide, please. Right, so this is how it comes. We open up, increase pressure in the balloon, the stent opens up, everything comes out, right? The stent stays in place, the blockage is gone. The next slide, please. Bypass, again, graft is done by, if there are multiple blockages. Initially, the surgeons were using veins from the leg to bypass the graft. Again, what is a bypass surgery? The blockages are not removed, but bypassed. A new road is made. So veins, vessels of the legs were used to bypass the blockages. However, veins means the vessels of the body. Veins carry impure blood, deoxygenated blood back to the heart. So you are asking the vein to do the work of an artery. Artery carries pure blood from the heart to the body. The grafts would get degenerated or reblockage within 5 to 7 years. The next slide, please. So internal mammary artery, which you can see on the left and right side of the chest, we have two arteries, and these are the ones which the surgeon doctor takes now and puts it, or sort of grafts it, attaches it to the point in your artery beyond the blockages. The mammary arteries or the radial arteries are known to stay open for 12, 15, 20 years with, or even beyond, with proper lifestyle and risk factor modification. The next slide, please. So there are ways to live up to 100, stay active and exercise regularly, be positive, stay close to nature, eat less meat, fat, sugar, get enough sleep, relax, do cancer screening, be an optimist.